Hey everyone, and welcome to This Explainer. Today, we're taking a deep dive into the science behind sterile technique. Going into this, it was so easy to just look at infection control as this dry, boring list of hospital rules. But digging into this material, it totally reframed my perspective. What we're actually looking at today is a high-stakes scientific defense strategy. We are literally engaged in a constant, silent war against an invisible enemy, these microorganisms that can cause devastating harm to vulnerable patients. So mastering sterile technique isn't just about ticking boxes and following rules. It's about building an impenetrable fortress. Okay, let's dive into this and see exactly how we build that defense.
Here's our surgical checklist for today's explainer. We're going to cover breaking the infection chain, clean versus sterile technique, the laws of sterility, creating a sterile field, and finally, common contamination traps. Section 1. Breaking the infection chain. Because before we can properly defend a patient, we really have to understand our microscopic enemy's attack plan.
Think of this as the life cycle of a microscopic threat. It's the chain of infection. It starts right at the source with the infectious agent, the bacteria, virus, or fungus itself, and moves step by step all the way down to a susceptible host. The organism basically has to find a reservoir to live in, a portal of exit to leave, a mode of transmission to travel, and then a portal of entry to invade a new person. If this chain remains completely unbroken, an infection is pretty much guaranteed. But as defenders, our ultimate goal is to shatter this chain. Every single link in this cycle has a corresponding clinical action that can break it. So, out of all the complex medical interventions out there, what do you think is the absolute most powerful way to shatter this chain and protect a vulnerable host? It's relentless hand hygiene. Honestly, it sounds so basic, right? But it is hands down the single most effective way to prevent infection transmission before and after every single client contact. It's your ultimate weapon. Section 2. Clean versus sterile technique. Let's look at the unforgiving boundaries between everyday cleanliness and surgical prep. Surgical asepsis. That is the scientific term for sterile technique. It's a protocol that eliminates all microorganisms. And yeah, that includes spores, which are incredibly tough and highly resistant to normal cleaning. This is an absolute state. There's no such thing as mostly sterile or kinda sterile. It's required for invasive procedures because you're literally bypassing the body's natural defenses and entering highly vulnerable, sterile body sites. To put it into perspective, on one side, we have medical asepsis, which is your basic clean technique. Its goal is just to reduce the number of microorganisms and prevent their spread. It's perfect for routine, non-invasive care, like taking vital signs or changing bed linens. But on the other side, surgical asepsis demands total elimination. If a procedure is invasive, say inserting a urinary catheter or setting up a central line, you absolutely must use sterile technique. You're entering a space where bacteria absolutely do not belong.
Section 3. The laws of sterility. Because this is an absolute state, it's governed by strict, unbreakable rules. The source material lays out these non-negotiable principles, and they are fascinating. Number 1, sterile touches sterile only. That is the bedrock of this whole science. Number 2, if a sterile item touches a clean item, it's instantly contaminated. Just one unsterile touch ruins the whole shebang. Number 3, the sterile field has to be visible at all times. If you turn your back on it, you can't guarantee its sterility anymore, so it's basically dead to you. And number 4, keep the field and your hands above waist level. In the science of asepsis, anything that drops below your waist is automatically considered unsterile. No exceptions.
In this sterile world, everything is guilty until proven innocent. It's a critical safety warning. If you question sterility, even for a split second, throw it out. If you aren't 100% sure an item is sterile, consider it contaminated. There is absolutely no probably sterile in this practice. Doubt equals dirty. Section 4. Creating a sterile field. Let's see how this impenetrable fortress is actually built step by step in a normal hospital room.
The order of operations here is everything. Step 1, always hand hygiene. We already established that's our number 1 weapon. Then, you find a clean, completely dry surface that sits above your waist. You carefully open the outer wrapper and then you open the inner sterile wrapper. But here's the kicker for step 4. You do this without ever reaching over the field. Once opened, the inside of that wrapper literally becomes your sterile field. And the very last step in setting up, applying your sterile gloves. Hand hygiene first, sterile gloves last. The physical space dynamic here is so critical to understand. You never reach across the field. You reach around it. Think about it. When you reach an unsterile arm over a sterile field, microscopic dust, skin cells, or bacteria can fall directly from your clothing or skin right onto the sterile supplies. Reaching across is a cardinal sin that immediately ruins your entire setup. Space and geometry matter immensely here.
Section 5. Common contamination traps. Let's look at the invisible, everyday threats that can instantly destroy a sterile field.
So here's a scenario that really made me think. What happens if a sterile field gets wet? Let's say a tiny little bit of sterile saline spills onto the sterile drape you're using as your field. Is it still sterile?
The answer is a resounding no. Wet equals contaminated. And the scientific why behind it is fascinating. Moisture draws microorganisms from the unsterile surface underneath the drape right up into the sterile area through a process called capillary action. The water acts like a tiny elevator, pulling bacteria straight through the fabric right into your sterile fortress. If water spills on the field, the whole thing is ruined, and you just have to start over completely.
There are a few more absolute scenarios that spell instant contamination. If your sterile glove even lightly brushes against an unsterile surface, change it immediately. You can't continue. If the packaging of your sterile supplies is torn, if it's expired, or if the field was left unobserved even for a moment, all of these mean the item is contaminated. Game over.
The source material has this brilliant set of memory tricks to lock this all down for your exams. First, the outer 1 inch of your sterile field is always considered dirty, so you must work strictly in the center. Second, moisture is dirty, all because of that capillary action we just talked about. And finally, doubt is dirty. If you're ever unsure, throw it out. Everything else inside those strict parameters stays sterile.
I want to leave you with a final thought here. The science behind sterile technique isn't just a set of arbitrary hospital guidelines. It's a rigid, physical defense system against microscopic threats. The laws of capillary action and gravity, they don't care if you're in a rush. So the next time you step up to an invasive procedure, ask yourself, will you treat sterility as the unbreakable absolute it is, or will you let the invisible enemy win? Master these principles, hold the line, and protect your patients. Thank you so much for joining me for this explainer. Keep learning, stay focused, and I'll catch you next time.